Welcome everyone to today's webinar. I am Brian Zimmerman with Becker's Hospital Review. We'll begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we'll be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Angela Maxwell has been a senior clinical consultant with Cardinal Health since 2015. She has nearly 20 years of critical care and perioperative nursing experience, with the last 4 in clinical leadership, directing 4 departments in 2 facilities under the Surgical Service Division. Throughout her acute care career, Angela has been a leader focused on safety, supply chain, value analysis, and quality assurance. Her responsibilities included managing a staff of 100 employees, staff development, orientation, education, policy procedure development, and implementation, as well as developing organizational best practices. Her latest career accomplishments include contributing her perioperative knowledge of proper cleaning and sterile processing safety in the OR, which was featured in a 2017 HPN and online article titled Seeing is Believing, Right? Today, Angela educates and offers clinical guidance to Cardinal Health team members and customers alike, helping align their needs with the broad array of choices in the Cardinal Health medical surgical product portfolio. Trisha L. Boring is a certified nurse in the operating room. She received her associate degree in science nursing from Germanna Community College in Fredericksburg, Virginia in 1995. Her healthcare career began in the operating room, completing the first Periop 101 program at Mary Washington Hospital in 1997. She received her RN First Assistant Certificate in 2008 from Delaware County Community College in Delaware, Pennsylvania. She received her Bachelor of Science degree from Virginia Commonwealth University in Richmond, Virginia in 2008. Angela, I'll now turn the floor over to you.
Thank you. Hello and welcome everyone. Again, my name is Angela Maxwell and I am the Senior Consultant for Clinical Operations at Cardinal Health. I am here on site at Mary Washington Hospital in Fredericksburg, Virginia, and with me today is our special guest, Trisha Boring. Trisha is the Assistant Nurse Manager of the OR here at Mary Washington Hospital, and I want to say thank you to Trisha for having us here on site and participating with us today. In the next few minutes, we're going to be discussing why it has never been more important to choose the right facial protection for each clinical situation in both the surgical and procedural settings. And we will see how ASTM standards were created to help you select the right mask every time. There are 5 key learning points we'd like you to learn, and will help better prepare you and your staff for selecting appropriate facial protection. Some of the objectives listed on this screen are designed to help you be better prepared to choose the appropriate mask. So let's start with the first objective. Number 1, after this presentation, you will be able to identify the 2 major classifications of masks, and also be able to identify a 3rd type of mask that is suitable for when surgical smoke or a known or suspected aerosol transmittable disease may be present, such as plumes during a procedure, or when disease may be present, such as influenza or tuberculosis. These are just a few examples of what we will be discussing today. The second objective is you will understand the risks associated with improper mask usage. And number 3, you will be able to describe the purpose of ASTM International and its mask selection standards. In particular, we will be referencing ASTM F2100-11, which is important because it sets standard requirements for the performance of materials used in medical face masks. You'll also have knowledge and an in-depth overview of the 3 ASTM barrier protection levels. And finally, you'll understand the 4 F's of how to properly select the right mask for each situation. So let's get started by sharing why Cardinal Health is uniquely qualified to help you. On this slide, we're going to be talking about Cardinal Health. People often ask me, who is Cardinal Health? And I always reply with, Cardinal Health is not only an industry leader, but it's the people at Cardinal Health that makes this organization extraordinary. It's a family-oriented environment with a diverse culture, and not just a job, but a home for me. I couldn't be more proud to be a part of this great company. So here are a few facts about Cardinal Health. With more than 40 years of experience, Cardinal Health is not only a recognized leader in healthcare, but we are also top-ranking when it comes to transforming healthcare supply chain services to help our customers meet the current challenges we face today around costs, revenues, and outcomes. As a supplier and leading manufacturer of medical and surgical products, we have an unparalleled understanding of the healthcare value chain. In particular, we have extensive expertise in personal protective equipment for the OR. In fact, we provide healthcare organizations across the U.S. with 722 million units of surgical and medical products every year. Another key strength, and maybe one of our most important ones, is our clinical support team ready to serve you. There are 2,500 clinicians throughout Cardinal Health, including a dedicated team to help educate your staff on the proper selection of masks for each procedure and setting. Again, I am happy to be a part of this extraordinary clinical team, and we as a team could not be more equipped to help provide you with the educational support on health and safety to your surgical team. With our combined materials management and clinical expertise, we're uniquely able to give you more of what you want most, and that is, it's a simple way to support your reputation by delivering quality care while at the same time decreasing your costs. Now let's turn our focus to masks, starting with an important question. Why is choosing the right mask important? There are three key reasons we want to talk about today. Number one is the risk of facial exposure to blood and body fluids to healthcare workers is a common safety concern. And as you'll see in a moment, that risk is real. In healthcare today, there has been increased clinical emphasis on reducing healthcare-associated infections. And there's also been a renewed focus on patient and staff safety, as well as quality initiatives. A catalyst for this effort has been the rise of new pathogens in the healthcare setting, which we're seeing an increase in these pathogens, as well as antibiotic-resistant bacteria, or what we also know as the superbugs. And a good example of the superbugs that we see today is MRSA. That's a common one. It's equally important to keep staff safe and protected from these superbugs, as well as the patient.
As part of our own safety and quality initiatives here at Mary Washington, education is paramount. Our goal is to help our staff make better decisions and wear the correct mask for each clinical setting.
Thank you, Tricia. Now let's turn our attention to the two major classifications of masks. The first classification is procedural mask, and the second is surgical mask. Let's talk for a minute about the differences between the two. What are the differences? We'll start with procedure masks. They are easily identifiable by ear loops and are used on hospital floors. Some other areas you may see an ear loop mask would be in isolation, in the sterile corridors, some processing departments, labor and delivery units have them, and ER and ICU have them for bedside procedures. I want to highlight that a good thing to keep in mind here is that procedure masks are not suitable for use in the OR. On the other hand, surgical masks are primarily used by OR staff and have two straps that secure the mask to the face instead of looped. How clinicians talk about the differences between a procedure mask and a surgical mask varies widely. There simply isn't a common language among clinicians, which brings up several challenges to healthcare workers. But to help overcome some of these challenges, Cardinal Health makes recommendations for usage based on guidelines established for the surgical attire guidance established by AORN, are also known as the Association of Perioperative Registered Nurses. And based on these guidelines, it's important to note that only masks with ties and not with ear loops are considered appropriate for surgical settings.
Another way to think about it is that surgical masks are designed for sterile environments and procedure masks are designed for clean environments.
Great. Now we're going to be discussing a third type of mask, which is the surgical N95 respirator. This mask is designed to support hospital policies and procedures around surgical smoke safety. We will discuss several factors that play a part in when an N95 respirator should be selected. This type of mask is recommended when the need for evacuating surgical smoke that is generated by energy-generating devices during operative or other invasive procedures. Some examples of this would be ESUs, lasers, and ultrasonic scalpels or dissectors. The N95 is recommended when anytime there is a need for wearing respiratory protective equipment as a secondary protection against residual surgical smoke. Also note that while wearing respiratory protective equipment during higher risk aerosol generating procedures on patients with known or suspected aerosol transmittable diseases is recommended. Examples of these diseases would be tuberculosis, varicella, and rubeola. These are just a few examples I've listed here. As consultants visiting customers' accounts frequently, we have observed that it is common practice for staff to incorrectly select a standard surgical mask with ties for these at-risk procedures, instead of choosing an N95 and leaving themselves underprotected and at risk. So now that we've reviewed the different types of masks, I'd like to hear from all of you on our first polling question. For question number 1, since we just discussed classifications of masks, we would like to know, what masks are you using for ECU procedures today? Please select one of the following. A, I don't know. B, a surgical mask with ties. C, a procedure mask with loops. Or D, an N95 respirator. We'll give you folks a few minutes to respond. Okay, so it looks like the response overwhelming is that 41% are currently choosing a surgical mask with ties for this type of procedure. So it's good to know, I hope you guys learned something today, that an N95 respirator would be the correct choice in this situation. So now that we have your feedback on mask ECU procedure protection, let's look at how the purpose of masks have evolved through the years. Masks were originally developed to minimize the risk of patient wound infection due to microorganisms that could be transmitted from clinicians via cough, sneezes, and droplets to the patient. Wow, things have really changed over the years. Today's masks are intended to protect both patient and clinicians from several risks, including new and drug-resistant pathogens transmitted by patient blood or other body fluids, smoke plume that can contain toxic chemicals and other irritants, and particulate contaminants that include dust dispelled by high-speed devices. And in my experience, the knowledge deficit is probably greatest here. It is not uncommon to walk into a, quote, dirty environment and see staff wearing an ear loop mask. Just last week, I was visiting an account where there was a total shoulder in progress, and 4 people in the room had on an ear loop mask, including the surgeon. Believe it or not, I observed this happening almost weekly. I actually had a discussion with the OR director and vaguely mentioned that I had observed this, and she said she wasn't even aware that her staff had access to the ear loop mask and had no idea where they had gotten them from. So I do what I can do to educate while I'm on site. But the knowledge gap is significant here because the risks are real. And when I say the risks are real, what am I referring to exactly? Let's take a look at some statistics. One of the greatest exposure risks is to bloodborne pathogens, including HIV, HBV, HVC, and many others. The risk impacts 5.6 million healthcare workers, and it's one of the top 5 causes of injuries among healthcare workers. Here's an important fact to take away. Blood or blood products are involved in 63% of exposure incidents. 26% blood exposures are to the head and neck of scrub personnel. 59% of blood and bodily fluid exposures are among experienced OR doctors. This goes back to the surgeon I observed with the ear loop mask. He was putting himself at risk by not selecting the appropriate facial protectors. That's just one example. 17% of blood exposures occur with circulating personnel outside the sterile field. Yet, 76% of OR directors make procedure masks available for their staff.
Not only are the risks physical, organizations and staff found without proper use of PPE can be fined in excess of over $25,000 for each infraction.
Thank you, Tricia. This leads us to our second polling question. We'd like to see how many of you are aware of the cost associated with exposure-related incidences or citations from staff-related injuries. Please select one of the following. A, very aware. B, somewhat aware. B, somewhat aware, or C, not at all aware. We'll give everyone a little time to respond. So it looks like 59% of you are somewhat aware, and it's good to know. I hope we have shed some light on and brought attention to the fact that costs are in fact on the rise. So I hope you guys are aware and take note of that. And in fact, the most influential factor in choosing a mask is simply what's available at the facility. So let's take a look at that data. On your screen are statistics from a recent survey conducted among hundreds of OR nurses, non-OR nurses, infection control practitioners, and other clinicians on how their staff is currently selecting masks. Just recently, Cardinal did a market research study with a key group, and here are the results. As you can see from these results, availability of masks ranked first, followed by training, comfort, and habits. Ranking below those are the ASTM standards for proper mask selection. Only 44% of survey respondents ranked ASTM standards as an influencer when selecting a mask. And that leads to a significant safety issue. Now we would like to hear from you. And this leads us to our third polling question. We'd like to understand how this group is selecting their mask today. So please choose one of the following. Which comes to mind first? A, you choose by what is provided to me. B, you're choosing based on what you learned in training. C, you're choosing for comfort. D, is it out of habit or what you've always used? Or E, are you leveraging the ASTM standard? And we're going to wait a few moments for you guys to respond. Great, it looks like the results are in, and about 38% of you are choosing what is provided to you at your facility. So again, this is probably aligning with what we're seeing in the study, and this is a good education point to always leverage the ASTM standards when choosing a mask. According to the same study, 75% of participants use the incorrect PPE for the setting. That may lead not only to staff and patient health risks, but it also can lead to regulatory citations and fines. Following ASTM standards would help solve that problem, but according to studies, the awareness of the standard is low. 48% of OR staff are unaware of ASTM standards and the different levels of protection, and a whopping 57% of face mask units sold in 2016 did not have or claim to have an ASTM rating. Tricia, what is your own experience with clinicians when choosing the wrong mask for the clinical setting?
Making sure you wear the right personal protective equipment, such as the right mask, is an important part of perioperative training. At our facility, we provide training to all healthcare staff as well as refresher training for our staff to help ensure that the proper mask is selected.
Great. Thank you, Tricia. Incorrect selection of masks is a significant challenge across the healthcare industry. So now we're going to take a look at medical judgment from the clinician when choosing a mask versus the ASTM standards. While 84% of facilities surveyed have a mask selection protocol, more than half of clinicians have said they use their medical judgment when selecting a mask, even if that falls outside of the protocol. The encouraging news is that 95% of those surveyed said they would change that selection if they had higher awareness of what the ASTM standards were. So let's take a moment to hear from you guys again in our final polling question. For our fourth and final question, we ask, does your institution have a current protocol based on ASTM guidelines? Please respond yes, no, or I'm not aware. This is just to get a sense from this group on where everyone stands with alignment to safety and compliance and mask selections around the ASTM guidelines. So it looks like over half of you, 53%, are not aware if your institution has a current protocol on the ASTM guidelines or not. So I think it's just important to remember that when choosing the mask correctly, you are choosing based on the ASTM guidelines. So let's take a closer look at those standards, and starting with the organization that sets these standards. This brings us to our next topic of discussion, which is ASTM International. Most people want to know what exactly is ASTM International and what is their role. ASTM's main function is to test products to improve quality and enhance safety. They also define more than 12,500 international standards across a wide variety of industries and services. The ASTM organization has been in operation for more than 120 years, with over 30,000 volunteer members in over 140 countries around the world. It's important to know that when healthcare organizations globally are looking to adopt and implement best practices, ASTM recommendations have become a vital part of this process. So now let's focus on the ASTM standards that are relevant to our discussion today regarding procedural and surgical masks. The ASTM sets standards for level of barrier protection for masks. We're seeing here on the screen the definition of the 3 levels of barrier protection that are set by the ASTM guidelines. So we'll begin with level 1. Level 1 is the lower barrier protection mask. Its general use is for low-risk, non-surgical procedures and exams that don't have the potential for any aerosol, spray, or bodily fluids. An example of proper use of this level mask would be an air loop mask. You may see this in hospitals with visitors walking the halls with a mask to cover their face when they have a cold, or if they want to protect themselves from getting a cold. You may also see clinicians using this mask for dressing changes, and it's used for bedside procedures. The level 2, or moderate barrier protection, it's for low to moderate levels of aerosol, sprays, or fluids, and we don't see this mask being used in hospitals much anymore. And the third is perhaps the most one to take note of, and that's the level 3. This is the maximum barrier protection mask. This mask should be chosen for any situation that has the potential for exposure to heavy levels of aerosols, sprays, and body fluids. Cardinal Health also recommends this level as a best practice for supporting OR safety initiatives. A few tips to keep in mind on moving forward. When you are choosing a mask for the OR setting, it is strongly recommended to use the level 3 surgical mask and the one with ties and not with ear loops. This is due to the opportunity for high velocity blood and fluid exposure. Lower levels of barrier protection, such as the level 1, may be appropriate in more general settings outside of the OR. So if you take away anything from today, please remember that when choosing the right mask, always look for the level of protection that is recommended by ASTM. And how are these levels determined? We're going to take a closer look. To determine if this mask is a level 1, 2, or 3, ASTM evaluates several characteristics. So let's discuss a few of these. You may have heard of some of these, and we'll just review them. Bacterial filtration efficiency, or BFE. This tests the droplets and the moisture exposure that is generated from cough and sneezes. And then there's the submicron particulate filtration, and that is the filtration from solid matter. And an example of this would be protection from dust particles. We have differential pressure, and then flame spread, or what we might refer to as mask flammability. But I really want to focus on the highlighted one here. This is the one you see the greatest difference between the three levels. This is the mask's resistance to penetration by synthetic blood. And you'll note the minimum resistance pressure in a level 3 mask is double that of a level 1 mask. This is why it is so important to choose a level 3 when you're in the surgical setting. You're getting double B protection. I also want to make a little side note here. I want to point out that it's common for not all manufacturers to test all the criteria that are listed here above, including the performance factors that we have discussed as well. And this leaves the mask user at risk. It is very important to make sure that you are protected and your mask is ASTM rated in all 5 of these categories. I would also like to mention that it's important to recognize that procedural masks are also rated by ASTM standards. And note that the N95 respirators are certified by an organization called NIOSH, not ASTM. So now that we've covered the 3 levels, let's talk about the best practice use of ASTM standards to select the right mask for each clinical situation. And that leads us to the 4 F's. Let's take a look at the 4 F's and how they play a role when selecting a mask. There are filtration, fluid resistance, features, and fit. The 4 F's can be a great tool when implementing best practice guidelines with mask selection. It helps the clinician to select the right mask while also addressing both safety and comfort concerns. So let's go a little more in depth into each category. For the first F we will talk about is filtration. The benefit of filtration is protecting us from smoke plume or diseases such as tuberculosis when in a situation where smoke is present or dealing with a TB patient. A high filtration mask is needed. And in such cases, an N95 respirator would be recommended in this situation. So move on to the next step, which is fluid resistant. You choose a fluid resistant mask where there is any chance at all of blood splatter or exposure to fluids. Level 3 surgical masks are recommended for these types of situations and should always be worn in surgical settings. That leads us to our next, which is features. And I'm just going to highlight some points through here. Features refers to loops or ties. So remember that, the features of the mask when you're selecting for loops or ties. Remember when choosing a mask in the surgical setting, always use a level 3 surgical mask with ties for best practice. And we're also going to talk about fit. This is a big factor as most clinicians are now choosing a mask based on fit. Remember that if your mask is not a good fit and not worn correctly, it leaves you at risk. Even if you have selected the proper mask for protection, it must be secured properly. And we also have an added bonus best practice known as the feel of the mask for comfort and breathability. It's just important to know that if one mask does not work or is not comfortable for you, there are many more acceptable masks available to meet your needs. And I'll give an example of this, and that is the duckbill mask that's being chosen over a flat mask. It's one of the most common masks chosen for the feel of it because the duckbill mask has an open chamber style. It allows for breathability and ease of talking. And most clinicians like it because they don't feel that suffocated feeling that they do with a flat mask. So the goal with remembering the 4 F's is to always keep safety at the top of your mind, and then to ask yourself, am I selecting the right mask to protect myself based on the ASTM standards? The key is to use these standards to support your choices around filtration and fluid resistance. Some other key points we want to remember about this slide is that it's equally important to note that even the right mask could put you at risk if it isn't worn correctly and secured properly. Cardinal Health has created a video that demonstrates the proper way to don and doff masks. It will be available and provided to you at no cost after this webinar. So Tricia, what has your experience been with using ASTM standards for mask selection?
Perioperative leaders are expected to do what's right to keep the OR staff safe. For example, here at Mary Washington, we have offered staff members options for the fit and feel that's most comfortable for them, while ensuring that each delivers the minimum level 3 protection appropriate for our setting. We do not permit or offer the procedure masks in the OR. We also partner very closely with supply chain team to ensure awareness and appropriate selection of the surgical mask. We cannot always assume that people understand the topic and the risks. That's why education is so critical.
Well, thank you, Tricia, for the valuable input. So in summary of what has been presented today, it's important to remember that the health hazards of incorrect mask selection are real, and 3 out of 4 mask selection decisions are actually incorrect. You should always follow your hospital protocol for mask selection. I want to add that Cardinal Health is focused on safety and adopting best practice. We use the 4 F's and ASTM standards for general guidelines and recommendations in appropriate mask selection. And again, we want to emphasize that ASTM level 3 masks provide maximum protection without compromising comfort and breathability. And in addition, N95 respirators protect when laser or cautery tools are used. If you need any assistance at all with training on Cardinal Health brand products, the Cardinal Health clinical mask team is always ready to help. We can provide additional resources as well, including a CE course and mask selection guide. Thank you all again for your time and attention today. We'll be happy now to answer your questions.
Thank you, Angela and Tricia, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for. We've got quite a few good questions coming in here. We'll start with this one. Do you have any best practices on how to highlight this topic with our staff? Thanks.
Okay, great. Tricia, did you have some input on this one?
Some of the best practices, as a guide, we typically follow the AORN recommended practices. And in 2016, when they revised the standard that discussed the N95 with use in the lasers, we would recommend that the practices be followed. We also will share the information on this recording at the Cardinal Health website after this webinar.
Great, thank you for those insights. And we'll move along here to another question. How can we tell if we are using masks that are ASTM rated?
That's a great question. A lot of the ASTM ratings are on the outside of the box. If you just look at the box, the ASTM rating is right there on the outside of the box.
That is helpful to know. And I've got another question coming in here.
Sorry, we wanted to add something to that as well.
Oh, absolutely.
I'm Megan Phillips, the marketing manager with Cardinal Health, and I just want to call out the fact that oftentimes your provided masks or dispensers and may not have visibility to those boxes. So I think one of the things that Tristan and I had discussed is just don't be afraid to ask to see those boxes or have those conversations with your teams as well. And oftentimes, as we said, manufacturers may test for some of these material qualification standards, but not all of them, and would not qualify as a completely ASTM rated mask. Good point.
Great, thank you. And this audience member says, my OR staff says it takes too long to wear a mask with ties. What do you recommend?
I've heard this as well in my OR, and quite honestly, you want protection over preference. It just takes, in a standard test comparing one to the other and applying, it just takes a few seconds longer. But the seconds longer it does take, it enhances your protection extensively. And so it's worth the extra 2 or 3 seconds to tie the mask.
And it's also notable, like we said, if there's one mask that you don't like, we have other options as well.
Fantastic. We've got some more questions coming in here. This audience member wants to know, so we use masks that say laser use on the box, but they're not N95. Shouldn't these be safe?
I think that's a good question to raise, and it's always good to ask questions of your peers or your director within the department. You do want to look for the NIOSH on the packaging, and if you don't see it, it doesn't hurt to call the company to validate or verify.
And I think that it's important to highlight that this was presented by ARN in 2016, so it's very possible that your manufacturer of choice may not have updated their standard packaging and recommendations as it relates to this recommended specification.
Thank you for those answers. And this next question here seems like a good one to close our discussion on. So what other tools or information do you have to share with us?
We have lots of information available. Before we have highlighted that we have a CBE course or an online course that's available that you can take at your leisure. It's essentially understanding facial protection and great details of information that can be provided there. We have an infographic that we'd like to share with you as well that you can share with your teams that highlights these risks and summarizes the importance of ASTM and mask selection, and also mask selection guides and product brochures that highlight the importance of this standard as well.
Great, thanks for sharing those. And that's all the time we have for today. I want to thank Angela and Tricia for their excellent presentation and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.